Hey YouTube. Today is pregnancy week 33, day 6, and on Saturday I'll be 34. Let me see, is that right? Yes, 30 week 33, day 6. Um let's see, as you can see, my apartment is still has stuff. I'm still trying to set up the crib. My husband, he's gonna help me do that this weekend finally. I don't know why, but I have dark circles, and I'm not even tired. I mean, I am tired, but I'm not even staying up late. And I don't know if it's just because of my skin coloring or what, but I don't know why I have that. Um, let's see, symptoms. Recent symptoms are dry mouth. I always feel like I'm constantly dehydrated. Sometimes I'll drink like 3 bottles of water during the night. And I drink probably maybe 6 to 8 of them during the day, and I still have this dry mouth, and I don't know why. It's really irritating, and it I always feel like I'm dehydrated, but I'm drinking so much water, going to the bathroom, still feel dehydrated. I don't even really drink soda or juice anymore, and still have the dry mouth. Um, let's see, the dry mouth. Sorry, my brain is just going everywhere. The dry mouth, and then contractions. I forgot to mention this my last video. The Braxton Hicks contractions are getting really, really intense sometimes, and I've already told my doctor, sometimes I get like 10 to 15 of them a day, and some of them I get like 2 or 3 in a row. And but they're not, some of them are pretty intense, but then some of them is just like a tightening and then it relaxes. And I always feel like I'm gonna be like one of those people that doesn't know that they're going into labor, and by the time they get to the hospital, their baby's like right there. Knock on wood. I'm not gonna be that person, but I'm always researching and looking up like what are the labor signs, how do I know. In my hospital, I'm about, I'd say 30 minutes away from my hospital. And so I know that I will probably most people go to the hospital when their contractions are 5 minutes apart. I'm probably gonna go once they're maybe 7 to 8 minutes apart, because it can change. And I've read stories where women, you know like I said, they come in and their baby's like right there, or like their contractions dramatically go from 10 minutes apart to 2 minutes apart. It just depends on your body, and I really want to be prepared for that. Um, so I'm always wondering if the real contractions are gonna feel like the Braxton Hicks, but just longer and more intense and obviously more frequent, or I don't know. So, um, also, I've been reading that you usually have telltale signs like losing your mucus plug, or like bloody discharge, or sometimes people get nauseous, throw up, have diarrhea. It just really depends on the person. So, that, and then let's see. Sorry, I'm just trying to think. Oh, sometimes when I get up quick, or if I turn around quick, like I get these little like stars, like, and I know people say that's a sign of preeclampsia, but I haven't had high blood pressure at all during this pregnancy. My blood pressure has been completely normal during the pregnancy, and it just kind of startled me. I was in the kitchen, and then all of a sudden, like, all these like white things were like shooting by my face, and I was like, what on earth is that? It freaked me out. But my doctor said, just be careful when you get up, and don't turn around too fast or sit down too fast and then get up again. It's due to, excuse me, like a equilibrium, like blood pressure. Um, Another thing is tiredness, for sure. I'm super tired. Started to get tired around this time of day. I usually can't stay up past one in the morning, and if I do, I'm dragging myself, and I just can't stay awake anymore. I used to be total insomniac and not sleep at all during the nights, just because I couldn't sleep, and then I'd sleep during the day. But now I have a normal sleep schedule, and normally women in pregnancy complain about insomnia during this part, like, oh, I can't sleep, and I'm perfect. I go to sleep around 12 and I wake up at around 9 or 10, sometimes later. I'm trying to get as much rest as possible. Also, because of my Braxton Hicks contractions, because a few times I got more than 4 an hour and they say to come to your hospital, but it happened when my husband was at home, and I didn't, I waited, I changed positions, I made sure I drank a lot of water to see if I kept getting contractions after that, and they went away, so I didn't feel the need to go to the hospital or call my husband and have him leave work to take me, because they say usually Braxton Hicks contractions, they will change when you change positions, or if you drink water, or if you get up or lay down, they'll stop. But true labor, it will just keep going. So that's how I knew that it wasn't serious. But my doctor says as the time gets closer, like after 36 weeks, if I keep having the contractions, she might, depending if she checks me and I'm dilated, I might have the baby early, because you don't want, because some people, when they get the preterm labor, I've heard stories where they go in and say they're 33 weeks, and the doctor, unless there's a life-threatening emergency, wants to keep the baby in, they'll give the mother steroids and other medicine to help stop the contractions. And my doctor, she said if you're after 36 weeks and you start having the contractions regularly, and if you're starting to dilate and efface and all that, then I won't, try to stop it. You can have her at 36 weeks, safely. So, that's that. And then, hip pain. Constantly, hip pain. If I lay on one side too long, I'm constantly switching sides, like every hour, every 2 hours in bed, because it just gets numb and it hurts and it sucks. So that's pretty much for my symptoms, and I see the doctor on the 24th, and then after that I'm on a week-to-week basis where I'll see her the 1st, and so on and so forth until my due date, which is the 27th of October. So now I will show you my belly shot. Ugh. Alright, so here's the front, this side, sorry, so definitely round, and I don't know if it's just me, but like I think she's kind of dropped, into my pelvis area. And there's the lovely stretch marks. So, yeah, that's horrible. Oh. So there's the linea nigra, and I actually have it going all the way up. And my belly button never popped. And my uterus is right about here. Wow. They just keep getting longer and longer as time goes on. So that's that. So my stretch marks are pretty bad, and you know, I did the whole oil and lotion and thing, and honestly, if you got stretch marks when you were growing as a kid, you will get stretch marks when you're pregnant because your skin is just programmed to get a mark when it stretches, and you know, you can't really do anything about it. And God bless all the people that don't get stretch marks. They should consider themselves lucky. And stretch marks aren't that big of a deal to me, so they'll fade, they'll go away, and it's not like I show my body off every day to people. So I'll go ahead and update you guys next week. And just to forewarn you guys, most people do like every week postpartum videos, and one for their baby and one for them. I personally don't think I will be up to it because you know, the schedule and all that. So I'm gonna do 2-week videos every 2 weeks, like 2, 4, 6, 8, 10, 12, combined with her and I. So her postpartum video, or her after videos, and then my postpartum videos will be combined every 2 weeks. And I can't guarantee that after the first 2 weeks after she's born that you'll get a video. It might be 3 or 4, you know, just depending how I'm feeling and stuff. So thanks for watching, and I'll see you guys next week.